But first, new procedures for those who suffer from gastroparesis. Joining us right now is Dr. Christopher Sanborn with Erlanger's Metabolic and Bariatric Surgery Center. When the doctors come on, they have all these great big words here, but I'm glad that the doctors come on to talk about this. So, first and foremost, we want to talk a little bit about gastroparesis, and that's a problem that obviously involves your stomach here, and some new procedures that are out there. But first off, what is that?
Yeah, gastroparesis is actually a disease of the stomach where it just doesn't work right, okay? And just taking the name literally means that the stomach, the motor activity doesn't work right. So if we look at our normal stomach, right, food will come in and it'll go out. Well, if the stomach's not propelling that food out of there, it will build up and it can make the patient sick. They can have reflux, they can have nausea, vomiting, can't keep food down, and it can get to be quite a problem for them.
Now, there are diets out there that can help. There's medicine that can help as well, but sometimes that doesn't work. And there's kind of a new stimulator that's out there or new to this region that can certainly help. Right.
When diet and medicines fail, then there's some other things that we can look at. One of them is the stimulator. It's an Entera stimulator that's out there. It looks just like a cardiac pacemaker, okay? And what we do with that, we actually take a couple wires from a little stimulator. The stimulator sits underneath the skin. It's about the size of a pack of Tic Tacs. And the wires actually come into the stomach, and we actually implant those in the wall of the stomach, okay? What that does is it actually sends little tiny pulses, little impulses to the stomach, and overrides some of the nerves that are feeding back to the brain that gives us those nausea and vomiting signals. Okay, if we can override those, we can actually help control that nausea and vomiting.
And who can get this stimulant?
Well, who can get it? It's going to be 18 to 70, so patients who are 18 to 70, people who have tried the dietary modifications, they've tried the medications that are out there, and they've worked with their gastroenterologist, and nothing else has worked, then we have this.
And those patients that maybe seeing the diet or medicine not working, is this something that's going to be, hopefully working better for them? And what's the success rate with this?
Actually, we've seen over the past decade or so, this product has been out on the market. It's just not been as available in this area. Prior to this, people have had to go out of the area to Nashville, to Atlanta, but now we have it in the Chattanooga area. And so you actually see a pretty good success rate. It's not 100%, so it's not going to be the cure-all for everybody that has gastroparesis. It's going to be, in the diabetics, probably about 70%. Okay, and we see a little bit better response in them than we do in the patients that have other causes for the gastroparesis.
Now, usually when we come to you, we've been diagnosed with this and that there is a problem, but maybe some of those listeners that are out there, what are some of those signs when they need to go to their doctor?
Right. A lot of times you'll see this in diabetics. Sometimes you'll see it in patients without diabetes, and sometimes it's in patients who have maybe had a viral syndrome or they've had surgery before. And what you see is sometimes it's just reflux. You have the heartburn and food kind of regurgitates. Sometimes it's nausea and vomiting, especially repetitively. When we talk about improvement in this, we look at patients who are counting the number of times per week or per day and decreasing those. And a lot of these patients will have been in and out of the hospital a lot because they can't keep the food down and stay hydrated or nourished.
Now, that's not the only thing that you guys do, because you also have a very good weight loss program as well.
Right, yeah, this is kind of the opposite end of the spectrum of what I usually do.
Sure.
Right, and it's the Metabolic and Bariatric Surgery Center for a reason. So we do the metabolic, that's the diabetes work, that's the gastroparesis work, and then on the bariatric side we do weight loss surgery. And we do the gastric bypasses and gastric sleeves, and so we can work on that end of the spectrum as well. So you can see both ends there at our surgery center.
And real quickly here in the last 30 seconds or so, to be able to have these type of procedures, this type of things that are available in this region at Erlanger, what's that mean, and what can we tell people around here that, where Erlanger stands?
Right. Well, I think that means that, we are trying to bring the best to Chattanooga, okay? And this wasn't previously available in Chattanooga. Like I said, it's been out about a decade, but we brought it here now. Patients before, when they needed this and they wanted to be evaluated for it, be up to 6 months to a year to get those evaluations done somewhere else.
All right, well, there's the information on the screen. If you do have more questions about these procedures or any questions, feel free to contact the folks there at Erlanger Medical Center. The phone number is 423-778-5465. That is 778-LINK. You can also go to the website, which is erlanger.org, and you can also do / and that is Christian Born, MD.
Chris Sanborn.
Chris Sanborn, MD. I'm having trouble reading today. All right, appreciate it, doctor, for coming on this today. All right, folks, let's say a big congratulations going out to